So this is our research update on brain-related topics for the month of April 2026. And what we're looking at is a wide variety of different topics kind of scattered across all over the place. There hasn't been that much interesting this month, but we have an article talking about traumatic brain injury and artificial intelligence, and essentially it's just talking about how useful this thing is. Now, what it goes on to say is AI can predict mortality in a hospital with a 95% accuracy, and also it can help detect who's going to do well, who's not going to do well, and long-term prognostication. The other thing it says is that it's also going to find out things that radiologists miss that could affect care. Now, when you look at something like that, what does it really mean? It means a lot of different things, but these will be trained on models of data. If that data set itself is not that great or high quality, the AI isn't going to be that much too. Does it take a lot of challenge to figure out who's going to die due to a brain injury in-house? Typically no. It just means you have to work a lot harder. So it's like the AI will tell you the sun will come up at 6 o'clock. Wonderful. You know, it's good that it does. If it does come up at 6, that's great. But we often know as clinicians who's not doing well, and it's more just how to work on them to get these patients tided through. The next thing we have as the topic is spasticity being treated by peripheral nerve stimulation. So this is a case of a person who has spasticity. They take needles and they put it near the different nerves of the arm, and they use a jamming frequency, and they find the spasticity comes down when the needles are in, and it persists for about a few hours or so. Then it goes away and the spasticity comes back. When we talk about spasticity to consider, what we're looking at is not deficiency of needles, it's not deficiency of current, it's an injury in the brain that is now manifesting as overactive muscles that lead to these deformations. So by blocking the nerve that transmits the signals, what are we actually doing? We're just kind of modifying a symptom rather than treating the actual cause. But again, there will be people who have very bad spasticity that can't tolerate these kinds of things, and the regular medications, they won't have money for Botox, they can't get surgery, etc. So this is something you could try. Another thing that's kind of interesting here is the Botox group has come out again, and what they're saying is Botox decreases upper extremity pain in spasticity, even up to 7 doses of Botox, 7 cycles of it. Now this is where things get to be a bit contentious, because again, spasticity in upper extremity is not due to deficiency of Botox. So what we're doing is we're blocking the neuromuscular junction. Is there a side effect to that? The main thing is you can end up giving so much Botox the muscle atrophies. It atrophies, end of problem. There's no more muscle to create a problem anymore. I don't know if that's the real endpoint here, but they're saying that 7 doses, and up to 4 or 5 doses when the atrophy really begins. So we can keep doing this thing, but again, we have to understand that spasticity and pain is not deficiency of Botox, and if the symptoms do come down, that's wonderful. But there are other ways that are not so expensive, nor do they have those kind of side effects. We're going to wrap up with 2 more studies here. One is the gut microbiome in elderly people in an assisted care facility. Now, many times they may not be getting the most nutritious diet. It might be something that's kind of high carbohydrate, high fat to make them happy and saturated and satiated. The problem with those kind of diets often is that they increase particular types of bacteria in the gut microbiome. And those would be Methanobrevibacter smithii and Alistippus finegolii, which are pro-inflammatory. But then these kind of diets, they also tend to show that bacterial clades decrease. So as the clades decrease, there isn't that much diversity in the gut microbiome, and these are actually the variety of bacteria that produce short-chain fatty acids, GABA, glutamate, all are different neurotransmitters. Meaning, if you're overrepresenting things that are harmful and preventing diversity in the gut microbiome, eventually the person suffers. Now you could say, they're elderly, they're going to expire anyway, who really cares? But they might care about being demented, or remembering their loved ones until they expire, or just enjoying life until it's time to go. So this is a trade-off when we don't have a good diet. The last thing is a systematic review on Argentine tango for Parkinson's disease, and they found 5 different randomized controlled trials looking at how great this is for it, and it shows this improvement and that improvement. Does everyone in Kerala have to learn Argentine tango? Probably not, but these local ethnic things are really appropriate for the places they come from, because people would have a sense or some cultural connection to those kinds of things. And when they do things that they're wired to do, and they do more of it, they're going to get better. Movement is good in Parkinson's. That's all for this month.